Happy New Year. Happy 2025. It's Dr. Foley here, and I wanted to share this video to introduce myself to new followers on my YouTube channel or my social media platforms, and reintroduce myself to those who've been following me for some time. And I thought this would be a great time to do that at the beginning of the new year. So Happy New Year. And in terms of my background, I'm a board certified fellowship trained urogynecologist, and educationally, I started my training in New York City. I went to college at the Sophie Davis School of Biomedical Education at the City College of New York, and then went on for med school at New York University School of Medicine. Excuse me, I graduated and then started residency and finished residency at the NYU Medical Center, New York NYU Downtown Hospital, and then went on to the University of Maryland and Greater Baltimore Medical Center for the remainder of my training in reconstructive pelvic surgery, urogynecology, and as a subspecialty. And after finishing all those years, yes, that's between 18 and 32. So 14 years of training, I then completed my training to be a subspecialist in the area of urogynecology and reconstructive pelvic surgery, where I take care of women who have issues with their pelvic floor muscles, ligaments, organs, nerves, and can present as pelvic organ prolapse, which is a drop of the organs, either the bladder, the uterus, or the rectum, or into the vagina, as well as most commonly, the things that occur as a result of prolapse can be accidental bladder leakage, accidental bowel leakage, recurrent bladder infections, pelvic pain, difficulty with emptying the bladder, constipation, pelvic pain, painful intercourse, recurrent bladder infections. Those are the things that affect many, many women. A lot of women don't find it easy to talk about because they may think they find it embarrassing. It's not easy to talk about, but it is common. And I like to tell my patients that they're not the only ones who experience it, but there are thankfully good options and solutions that are available for women nowadays to improve their quality of life. So women no longer have to live or put up with these things. And so after finishing my training in Maryland, I then, my family and I relocated to Pennsylvania, where I started working at the Lehigh Valley Hospital in Allentown, Pennsylvania. And we were in Pennsylvania for almost 12 years. And I was the chief of urogynecology there for 6 of those 12 years. And then relocated. And now I practice in Metro Atlanta and affiliated with the Northside Hospital. And I take care of women in Atlanta here. And so I've been a urogynecologist in total for over 20 years. And I absolutely love it. It's my passion to take care of women. It's been my honor and privilege to be able to contribute to relieving this condition and solving this and bringing solutions to this problem that affects many, many women. And so why do I do this? Because women deserve great care. Being a husband of my wife for 22 years now, and having 2 daughters, a mom and sister, women's health is very, very important. Why? Because it affects every aspect of healthcare and affects a family. And so being able to take care of women all these years in this capacity has been my utmost privilege and honor. And so that's that. And I take care of women, whether it's in the office, and then there are women who, if surgery is an option or is their desired solution, then I perform vaginal surgery, robotic surgery to take care of these conditions that affect many, many women, and thankfully successfully as well. And so in terms of on a personal note, I am the firstborn of 3 children. And let's see, I grew up in Brooklyn, New York. My parents are first generation Nigerian immigrants. And so they came to New York City to finish their college and professional schooling, and had their kids in the process. And so I have a brother and a sister. And after finishing kindergarten at the age of 6, went to Nigeria with my family and lived in Nigeria for 7 years before coming back. So went to what would be considered grade school here is considered primary school there, and what would be considered middle school here is called JSS, or junior secondary school there. So I started junior secondary school or middle school over in Nigeria But then my parents and our family relocated or emigrated back to the United States, and then spent the remainder of the time finishing high school in Brooklyn and finishing college in Manhattan, and then going on to medical school and my training in Maryland. So yeah, so it's been great. Having that upbringing in Nigeria has really added such. It's just been such a blessing in my life. Why? Because I got to experience two different environments. My formative years were in Nigeria, that kind of my roots, and it's shaped who I am in the terms of appreciating people, cultures, and all the things. So that's kind of my upbringing. The other thing that's important to me and utmost important to me is my faith. I am a believer of Christ Jesus, and I have been for several years. I grew up in a Christian home, but officially rededicated my life at the age of 25 at that time, and that decision then became mine to follow Christ. And the reason why that's important to me is because it dictates how I live, how I take, and how I work. It's helped me to bring excellence to the work I do, because I believe that's important. Women deserve excellent care, and so I bring that excellence to the work that I do, both in my work as well as my family. And so, being a believer of Christ Jesus has been pivotal in terms of shaping my thinking and my approach to work, and my approach to my family and to people. And so, yeah, in terms of family life, I've been married to the same woman for 22 years, happily. She's the love of my life. And she is the mother of 3 children. So God blessed me with 3 wonderful children through her, and 2 daughters and a son, and tweens and early 20s. And so it's been a blast. That's the joy of my life. And the most important decision, aside from or next to giving my life to Christ, is marrying my wife and being a father to my children. And the things that I enjoy as a family, well, I should say one more thing. So we do have one additional member of our family, and that's Cooper. He's our pet. He's our miniature golden doodle. And yes, he's a ball of fun. And yeah, it's just like having another child, essentially. But yeah, he's great. He's 5 years old and forever puppy because he's a miniature, and just, his life is just feed me, love me, rub my belly, and walk me. It's so simple. But yeah, he's added a lot of laughter and memories to our family. So yeah, so that's that. Let's see here, what else can I share in terms of interests? I like the outdoors. Love traveling. Love experiencing new places, new restaurants, great food. Let's see here. The perfect vacation for me would be somewhere warm, where there's a beach, pool, great book, and being able to, spend time with my family, take a nap, wake up, the ocean, love it. That's the outdoors. That's my happy place, And so that's that in that respect. And I also like quiet time, a great walk, thinking time. That's my, that grounds me. Okay. So that's that. And so, a little bit more about me, and the reason why I wanted to create this intro video or reintroductory video is so that you who are watching, a patient or a future patient, colleague, or referring doctor can learn a little bit more about me. The reason why I'm so passionate about pelvic health and female pelvic health is because these are conditions, again, that affect women nowadays. It's very common. A lot of women, unfortunately, live and put up with it. They're embarrassed. They think they're the only ones who experience it. They don't know that there's good help, that there are safe and effective solutions to improve their quality of life. Why? Women want to be attractive, want to feel confident, and don't want to necessarily or should live with these things any longer. And so seeing a board certified fellowship trained urogynecologist is key. And that's the passion and the expertise that I bring to my field every day, and bring, whether it's taking care of women in the office or taking care of them in the operating room, whether it's complex vaginal surgery or robotic surgery, sometimes a combination of things, or just counseling women on preventive ways to prevent pelvic floor issues. It's been a privilege and an honor of mine. And so you may be a referring doctor, you may be a colleague or patient or a woman who is listening to this and know that there are good option solutions, and seeing a board certified urogynecologist is key. The way to reach me, my website has more information about me, and that's www.drtugbiyele.com, and that'll be in the description. I also would like for you to subscribe to my YouTube channel, and so there'll be a link to do that, and just click subscribe and also hit the notification bell so that when I create future videos, you'll be the first to know about it. I am very passionate about educating my audience, and I love to be able to, to have you be, to benefit from that. So yes, definitely go ahead and click and subscribe to my YouTube channel. So that ends my video, and look forward to seeing you in the next one. You have a great one. Take care. Bye.